generation of electricity and climate change, technology in healthcare, universal healthcare, and the changes in the Office of the Director of Public Prosecution, the DCI, and the ACC. Live from All in 30 Minutes Studios, I'm Osoro Nicholas, and I'll be with you for the next 30 minutes. This is where we give you all the developing stories and the emerging stories for only 30 minutes. Remember, you can join the conversation. The hashtag is All in 30 Minutes, and on Facebook you can get us in All in 30 Minutes. Over the past few years, the Kenyan government has invested heavily in generation of energy using renewable sources of energy. In today's story, we tell you what are the benefits and how does it relate to climate change. But first, here is Jason Mwangi with more.
For many years, Kenya has been running on energy generated from diesel-propelled generators to a larger extent of energy generated by water. This has proved to be a very expensive adventure both for the government and the consumer. The bill generally goes up during the dry period because the levels of water in the dams reduce. But for the last 5 or so years, the government has stepped up its efforts to generate energy using solar and geothermal. For many years, we have depended on other forms of energy, but now the narrative is changing. Jason Mwangi reporting for All in 30 Minutes, Nairobi.
And to expand more on this, now our correspondent Jason Mwangi joins us live from Nairobi to tell us more about the taped package that he has just done. Thank you very much, Jason, for joining us.
Thank you very much, Nick, from our studios.
So from the taped package that you've seen, that you've done, some of the emerging issues are that the Kenyan government has not been able to tap on the current sources that they have on generation of energy. What do you think the government needs to do, and what are the benefits of this?
Yeah, and one of the things Kenya is trying to do is to cut cost for the expense that they have been using, and that is going to reduce also the cost to the mwananchi, the common mwananchi. They will reduce the cost to the common mwananchi, and also the cost will be reduced to the government. And also one of the things they are trying to do is to make Kenya a cleaner environment, and also it is going to reduce and also to cut, or rather to cut the global warming emissions.
Another question, do you think that the government has been able to exploit all the resources that it has that are supposed to generate energy, like, for example, the rivers, even the solar?
Yes, Nick, we are not yet there, but this is one of the things that Parliament is trying to pass in the Parliament, so that we can get to see that we are trying to get to the renewable energy sources.
And that was Jason Mwangi live from Nairobi joining us. Thank you very much, Jason, for joining us. It is always a pleasure having you around. Now to talk more about this, we are joined by Ken Omwaka, an electrical engineer, to expand more on this and tell us what are the advantages of using renewable sources of energy. Thank you very much, Ken, for joining us. The first question that I want to pose to you is, why do you think the government is focusing more on generation of energy using renewable sources as compared to the sources that they used to use before?
Thank you very much. The shift towards green energy is long overdue, in the sense that if you look at the energy demand that we have as a country, currently we have a generation capacity of around 2.4 gigawatts, and it's projected that by 2020 this is going to grow up to around 3.6 gigawatts. So, number one, we need to invest to increase this capacity. But then we ask ourselves, which is the most suitable source that can help us to hit this capacity. As you know, in Kenya, we've majorly relied on hydropower, which constitutes around close to 57% of the total capacity. And moving forward, we are investing more in green energy, because we still have a bulk of our plants relying on thermal energy. So around 32% of our generation capacity still relies on thermal fuels, which one is very expensive. the running costs are very high, and you know, as a body, the cost of power is passed on to the final consumer, which of course increases the cost of electricity. So we need to bring that down. Number two, the issue of carbon emissions. You know that with thermal plants, there's a lot of carbon emissions, and it contributes to climate change. And as you can see, this is something that has become evident, especially in the past few years, where we are seeing varying climatic conditions, and the realities of climate change are here with us. So we have to invest in green energy because, one, it's a more environmentally friendly solution, and two, because it will contribute significantly in dropping the cost of power, especially to the final consumer.
And what can you tell us about this in relation to generally climate change?
Thank you so much. If you look at geothermal energy, this country has a very great potential for geothermal energy. We've just tapped less than 5% of the total capacity. So geothermal energy, if you combine that with solar and with wind energy, you find that we are able to boost our capacity for green energy. So when you talk about green energy, we are looking at all these viable options so that we can combine them and come up with an integrated system that brings all these solutions together. So geothermal is great because it also has a good capacity, in the sense that we are able to generate considerable power from geothermal energy. Yes.
So what are the benefits of this? What are the benefits of using of generating energy using renewable sources?
One significant advantage of green energy is reducing costs. Because in as much as the initial cost of installation may be high, you find that the running costs per unit of electricity becomes lower, and that translates into reduced costs to the final consumer. And when costs go down, productivity, of course, goes high. The other advantage of green energy is, of course, the green. By being green, it's environmentally friendly, and it's something that we can use over and over again without having detrimental effects on the environment. The other advantage is, if you look at the way green energy works, we are able to develop microgrids. So you find that, for example, we can set up a microgrid in an area, in a very remote area that is difficult to reach with the grid. So it enables us also to provide power cheaply in remote areas that are very expensive to take the grid there. So it allows us to have, let me call them localized solutions. Yes.
And do you think as a country we are able to move away from generating energy using sources that are not renewable to mainly focusing on sources that are renewable?
A few years ago, when we were talking about matters of climate change, it appeared just like some theories, but now we can see these things. Yeah? We are seeing delayed rainfalls. Currently, we can see people dying in Turkana because of changing climatic patterns, prolonged droughts, and when it rains, we have very heavy downpours. So climate change is a present reality, and we have to we have to change our programming, not just in terms of energy, but we have to change the way we look at things, so that by the end of the day, we are able to take much more care of our environment. And the other issue, we need to bring down the cost of power, because Kenya is now a middle income economy. We need to boost our our industries. We need to boost our access to power, not just within the major towns and within industrial zones, but also to the rural areas. So we need to increase our capacity to generate power. And as we do that, we need to look at solutions that are more sustainable, not only in terms of costs, but also in terms of environment.
Thank you very much, Ken, for speaking to us. It is always a pleasure having you around. Technology has been of great importance, more so, in helping humans run their day-to-day lives. In today's program, we tell you how technology is being used in our hospitals and how technology is being used to run the current medical services in the country. But first, here's Laura Nell with more.
ICT in healthcare, otherwise known as e-health, is the focus of the Ministry of Medical Services as the government increases its activity level to improve healthcare delivery throughout the country. Strategic planning is well underway and selected task forces have been set up. The question many people are asking is, how is ICT applied in healthcare? ICT in healthcare takes many forms. Simple Health Management Information System, HMIS, are used to manage hospitals and clinics, monitor patient expenses, control pharmaceutical stocks, and the dispensing of pharmaceuticals. Healthcare ICT includes the use of mobile phones to access medical data, to remind patients to take their drugs, and numerous other applications presently in development. The most sophisticated applications of ICT are to be found in telemedicine, where images of X-rays or disease are transferred electronically to an expert for evaluation and opinion. Telemedicine also includes distance monitoring of surgical operation by experts using cameras on site and voice communication to enable this expert provide advice for complicated surgery. Mobile telephony in healthcare, with 4 case studies from around Africa, a Kenyan wireless communication project for HIV/AIDS patients, internet learning for nurses in rural areas, and the benefits of ICT in development of the National Hospital Insurance Fund Administration in Kenya. Laura Nell, all in 30 minutes.
And now to explain more about this, we are joined live by an expert who is more knowledgeable on matters technology and all matters IT. So thank you very much for joining us. We will start by asking you generally, what is networking?
Okay, so a network is basically a number of computers that have been linked together to allow sharing of resources. Basically, there's a file server. There's a server that contains files and storage of files and emails.
We will go ahead and ask you again, what are some of the disadvantages of this?
Okay, some of the disadvantages of networking are that it can be expensive for the basic layouts. When you're building a network in a hospital, you have to do basic wiring, which can be expensive. Yeah. Another disadvantage is that managing a large network in especially hospitals can be complicated, because you'll need training, you'll need to understand all the devices that have been laid out. So it can get pretty complicated and you require a large team to do it. Another disadvantage is that there are viruses, and because all the computers are linked, it's easy for viruses to spread among the computers. And also there's the danger of hacking. Especially in a wide area network, when there's a small loop in the network, it's easy for hackers to intervene, and that could affect the whole network of the hospital.
Do you think some of the information that patients give that has been incorporated in this technology and networking is safe?
Okay, the advantages are file sharing. You can easily share files in the hospital from one office to the other. Another advantage is storage. There is the file server that carries all the storage, so information cannot easily get lost. Everything is backed up, and the security is also good. The users cannot see other people's files, and like on standalone machines where it's easy for the security of one machine to be hacked. Also, the network users can communicate using email and instant messenger. Site licenses are also easier to acquire and cheaper than standalone licenses. So it's easier to acquire the licenses.
Thank you very much for joining us. It is always a pleasure having you around, and we appreciate the knowledge that you've given us and the knowledge that you've given to our listeners and our viewers. Thank you very much. The Universal Healthcare, UHC, was rolled out by the government in 4 counties that are supposed to pilot the project 4 months ago. In today's story, we tell you what is Universal Healthcare and what are some of the benefits. But first, here is our reporter with more on this.
President Uhuru Kenyatta launched the Universal Healthcare Coverage UHC pilot project in Kisumu County on 2 months ago amid much fanfare. The new initiative is expected to herald the transformation of country's health sector that is marred by inequalities because of poverty and lack of medical insurance. Besides Kisumu, Nyeri, Isiolo and Machakos counties will also pilot the first phase of the program that targets 3.2 million Kenyans with full rollout in all the 47 counties expected by 2022. But just what is universal healthcare? What does it entail and who is eligible? Most importantly, what are the benefits and the range of services that one can access services under this program? Millions of Kenyans cannot afford to pay for health services in public or private clinics because of poverty. A 2014 World Bank report on healthcare in Kenya showed that only 20% of Kenyans have access to medical insurance. All Kenyans are eligible for UHC services. You need to obtain a UHC card which will be issued by National Hospital Insurance Fund NHIF in various health facilities. To access UHC services, you are required to produce your UHC card. But exactly what are the benefits? Kenyans will have increased access to preventive, curative, rehabilitative, and palliative health services at minimum financial burden, thereby eliminating inequalities in access to health care. Kenyans will also have free consultation, diagnosis services for normal ailments and get drugs for free. Also, UHC is expected to boost access to medical and minor surgical services, maternal and child healthcare services through the support of elaborate public health education. The program will also enhance HIV, tuberculosis, and malaria treatment in the country. Reporting for All in 30 Minutes, my name is Sharon Muhwana.
To expound more on this and to tell us what is universal healthcare, we are joined by Israel Lugadiru, one of a student in Daystar University taking communication. So Israel will move straight to the point. From your understanding, what can you tell us? Generally, what is universal healthcare?
Universal healthcare is just a healthcare insurance that covers basically everyone. For those people who cannot afford private healthcare. As you know, healthcare in Kenya is very expensive, so universal healthcare is more or less like an insurance that covers everyone in the country. Yes, it's you can compare it to America's Obamacare, which is not in effect today because of the Trump administration, but yes, it's just an insurance that for everyone basically.
Another question that I want to pose to you: do you think the government is ready to roll out universal healthcare?
Yes and no. I'll say yes because I feel like the government is very much ready and they have the capacity to do so. And I cannot, of course, undermine them because they are rolling out global numbers and it's actually being accepted widely in Kenya, something that I never expected. But then I say no because bodies like NHIF, the National Health Insurance Fund, are the bodies which usually pilot and they spearhead the agenda of universal healthcare. But then we have seen a lot of financial malpractices, a lot of corrupt scandals going on in NHIF. Therefore, it's a very hard thing for the government to convince the masses that they are ready for the project.
Connecting that to what you've said, we know that currently even the country and even the counties, we don't have enough personnel to run this kind of hospitals, and we even don't have enough hospitals. Do you think the government going ahead and starting to roll universal healthcare that is supposed to cover each and every citizen, when at the same time we don't have enough hospitals and enough medics, do you think it is the right thing to do, or the government is just rushing into decisions?
Honestly, when it comes to hospitals, of course the country does not have enough hospitals as we are currently talking. But the government is working day and night to ensure that there is adequate hospital coverage. So when we talk about personnel, the thing is, I think the personnel that we have is not bad at all. It's not very bad. But then what I'd like to say is that universal healthcare will just give insurance to the citizens of Kenya. Therefore, the citizens of Kenya are going to be able to afford healthcare, and not such a majority of them fail to go to hospitals because they do not have the money or they do not have access to hospital services. Most of them just don't go to hospitals, especially in the rural urban areas, because of their traditional beliefs and also their religious practices. But then when it comes to a matter of personnel, I don't think so.
Thank you very much, Israel, for joining us, and thank you for speaking to us here in All in 30 Minutes. Will we ever succeed in fighting corruption as a country? This and many more after the short break. Thank you very much for staying with us. The office of the DPP, the DCI and the EACC have all seen changes for the last few months, all with the aim of fighting corruption. In today's program, we examine if these changes will make an impact or if these changes are just political. And more on this, here is Ken Kimani.
The simmering row between the Ethics and Anti-Corruption Commission and the Directorate of Criminal Investigations has finally boiled over in what might slow down President Uhuru Kenyatta's anti-graft war. EACC has for the first time publicly told the office of the DCI to keep off the investigation of the economic crimes, laying bare their quiet tough wars. The blistering attack on the DCI came at a time when the new team, led by George Kinoti, who came into office on January 19th, are determined to give the organization an image makeover, a departure from the soiled public perception. Kinoti and the new DPP Nordin Haji are the new anti-corruption sheriffs in town and seem to have the president's attention much more than the 21-year-old EACC, which has become a spectator in the latest high-profile probes. Observers and the media have been quick to notice that the EACC has been missing in action in the second NYS scandal, Kenya Power, Kenya Bureau of Standards and Poison Sugar investigations. In the NYS, Kenya Power and KEBS cases, Kinoti and Haji have struck at the heart of the parastatals by staging dramatic arrest of senior executives, sending a chilling message to the high and the mighty. EACC has, on the other hand, and is still struggling to put together a watertight case in the Ruaraka land case. Under Section 7 of the EACC Act, the Commission is mandated to investigate corruption, prevent graft, advise public institutions on how to fight corruption, educate the public, enlist public support in fighting corruption and economic crime, and recover ill-gotten wealth. On the other hand, under the National Police Service Act 2011, DCI has the mandate to not only collect and provide criminal intelligence, but also undertake investigations of homicide, narcotic crimes, human trafficking, money laundering, and terrorism. Reporting for All in 30 Minutes, my name is Kennedy Kimani.
And that was our very own Ken Kimani with the story. And now joining us live from our Nairobi studios is Hesbon Wheeler, political analyst, to expand more on all the changes that we've been seeing in the Office of the Director of Public Prosecution, the Director of Criminal Investigation, the DCI, and the ASCC. Thank you very much, Husband, for joining us. I will ask you this question. Do you think the war on corruption is targeting individuals or is targeting people from a certain community?
Well, of course, the changes are supposed to make these agencies a lot more efficient in the way they're fighting corruption. It's only that now with the changes, we also expect corruption to muscle itself and fight back. So people know that there's a new sheriff in town. People get to understand that things are going to be done differently. And because corruption definitely fights back, they're going to come up with new strategies of fighting back corruption. But I think having said that, you also realize that a lot of the corruption cases are given some political slant. And the moment they're given political slants, it basically makes the work of whoever is appointed a lot more difficult. And after a period of time, they're also stand to be people who are fighting political wars, which is very unfortunate.
And do you think these changes are just political? These changes are supposed to enhance the war on corruption?
No, basically, just politicization of corruption. I mean, corruption is not tribal. If you steal, you're not stealing for Kalenjins, you're not stealing for Luos, you're not stealing for Kikuyus, neither are you stealing for any other tribe in Kenya. You're stealing for you and your loved ones. And if they encourage you to steal, they should suffer the consequences when you suffer the consequences of stealing. And for me, the whole Tanga Kieleweke nonsense is just that. It's a public nuisance. These are people who are making noise in the public domain, and I don't think we need to pay attention to them. There is nothing to elewa, and there is no one who is Tangaing. And if there is, it simply means that they're giving us a reason to make an informed decision. If someone is saying that they are being targeted, I think Kenyans are a lot more informed. They would know whether you're being targeted or it is real. If somebody else is telling us Kieleweke and they are hell-bent on blocking someone from becoming the president, I don't think any member of the political class can stop the will of the people. If the will of the people is to vote for William Ruto, it doesn't matter whether the Kieleweke team explains from here to wherever the reason why people should not elect the deputy president. The question we're asking ourselves, what are we supposed to elect that we've never elected from the beginning? We understand that the politics in this country is institutionalized and entrenched in corruption. So no one can point a finger and say so-and-so is more corrupt than the other person. What we believe is that the institutions that are charged with the responsibility of investigating corruption and apprehending those who are corrupt. No one can deceive any Kenyans that there is someone who is corrupt in the public domain. You're only as corrupt as the evidence that is adduced in court. And for me, the Kieleweke and Tanga nonsense is just that.
Another question that I want to pose to you is that so far we've not seen any convictions being done. Do you think it is the cases that are brought up, or it is just the cases are just fabricated, or it is the evidence that is brought to the courts that is weak?
Evidence that can convict you in a court of law. So what we have is agencies fighting corruption plus the media, publicizing even things that cannot even hold water in a court of law. And Kenyans are paying for the bloods of people who probably are not corrupt to the magnitude that politicians are publicizing in the public domain. And it becomes unfortunate because then when you are publicized as corrupt in the public domain and there is nothing incriminating, you are paraded in the corridors of justice and you're found to be innocent. What does that do to corruption? It glorifies corruption because you're given media attention. And then you go to a court of law and you're found to be innocent. The image that has been created in the public is that corruption will always trump. And who creates that? People who make noise. People who convict people in the public domain. So if we allowed ourselves to just follow the due process, that we have EACC, we have the Office of the DCI, charged with the responsibility of investigating and giving these files to the DPP. If they do their work and they have concrete evidence without making noise, and these files go to the DPP, people are charged in a court of law, would succeed in fighting corruption. But if we make noise, what we are going to do is to bastardize corruption and politicize it. And we'll end up with any other person who is corrupt will hide that this is politics, you know. And corruption has a way of fighting back. And one way of fighting back that we've given corruption is politicization. That anyone who is suspected of corrupt activities simply says that these are my political enemies.
Thank you very much, Husband, for speaking to us here at All in 30 Minutes. Thank you very much for being with us for the last 30 minutes. It has been a pleasure having you around, and thank you for keeping me company. And remember, the opportunities that tomorrow brings are not the same opportunities that today brought to you. I've been your host, Osoro Nicholas. Till next time. Bye.